Hey, this is Rob Smith from The Body Project, and today what I want to talk about is, can you trust the expert? So typically when I'm doing an orthopedic evaluation, when someone comes in with pain, and just the other day I had a gal come in that was experiencing pretty serious knee pain. But for this story, you could replace it. It doesn't matter if you're talking knee pain or shoulder pain or hip pain, low back pain. Any of these orthopedic problems, you could actually just fill in the blanks. So one of the first things, let's say you go to an orthopedic doctor, which she did. So a lot of times there's going to be an examination. So the first thing, when they examine it, they're going to take a look at the integrity of the joint. They may do an x-ray, they may do an MRI, they may do a CAT scan. So once they do the evaluation, now they can actually make a recommendation. And so the recommendations might be everything from physical therapy, so they're dealing with the structural component. They might have you fill a prescription drug, so maybe a non-steroidal anti-inflammatory. They may do a cortisone shot. So this particular client had actually opted for a cortisone shot. So when she came in, she had had a cortisone shot just a few days ago and she was still experiencing pain. So sometimes cortisone shots are like miracles, and sometimes they take a little while longer, and sometimes they don't work at all. So anyway, she was still having a lot of pain, and the other thing would be a potential surgical intervention there. So in my opinion, based on the orthopedic examinations I do, 80 to 90% of the orthopedic surgical procedures done today would not have to have been done had people understood what was really creating the pain mechanism in the first place. So getting back to x-rays and MRIs and CAT scans, here's what you'll see. You could take 100 people off the street that are asymptomatic, meaning they are experiencing no symptoms whatsoever. Now, let's say their range is anywhere from 40 to 70 years old. And you do an x-ray or an MRI or a CAT scan on these individuals, you'll find things like herniations, you'll find bulging discs, you'll find arthritis. You will find a whole host of degeneration within these people's bodies, but yet they're not experiencing any symptoms. So herein lies the problem. Many times when a person is experiencing pain, the doctor will say, well, look at your x-ray, you've got all this arthritis in the joint. Or look at the MRI, you can see how this particular tendon or ligament is inflamed. But many times they're not getting to the real root of the problem, which is, why did I develop this condition in the first place? So remember, if we're looking at conventional medicine, many times we're talking about symptom suppression. The symptom is, in this case, would be knee pain. But again, think about low back pain, shoulder pain, any type of joint pain that you've ever experienced, or you know someone who's experienced joint pain. So our approach at the Body Project is a little different. So when we talk about a holistic approach, we want to be able to ascertain what is the root cause of the pain and why did this pain manifest in the first place. So using our model, what we're going to look for is it a structural problem? Meaning, is there some imbalances? So let's take this knee pain, for instance. Many times what I see is there's a lot of trigger points or tight muscles in the inner thigh, which does not allow the knee joint to move properly. Now, with this particular person, I identified that within 1 minute. I knew exactly what to look for. I went right to those trigger points, and I spent probably 10 minutes on those really tight muscles, and her knee pain went away. It was literally that quick. She couldn't squat. She was having difficulty walking down the stairs. She had already had a cortisone shot, and literally in 10 minutes, we completely got rid of her knee pain. Now, one of the things we have to evaluate, just because someone gets out of pain, does that necessarily mean they're fixed? So sometimes we have to look at other variables in place. So another thing too is sometimes a food intolerance can create inflammation in the body called systemic inflammation. And so by eating a particular food that you might be intolerant to, or even a worst case scenario, you could have an allergy to, that creates inflammation in the body. And so that inflammation will always settle to the weakened tissue. So if you have weakened tissue, i.e. a knee issue or a back issue or hip issue, what's going to happen is the bugs, if you will settle in those weakened tissues. And so you could actually be eating foods that are inflaming you, and one of the top pro-inflammatories is sugar. I mean, we have so many people that are addicted to sugar, and you've got wheat, you've got dairy, you've got nuts, you've got so many different foods out there that people have intolerances to. So many times they'll do symptom suppression, but yet they're not going to the root cause. And so that symptom may be suppressed for a short period of time, but then it comes back. So again, we always got to get to the root cause. Another thing too is chemicals, heavy metals, scars, emotions. Emotions are always an integral part in most orthopedic problems. And that's something that obviously very few people address. And then the third one, or the last one, would be an immune challenge like bacteria, or viral, or parasitic. So you can see when you go to an orthopedic doctor, you're looking at one component, you're looking at the structural component. When in fact there's 1, 2, 3, 4, 5, 6, 7 different variables we want to look at. So again, just because they give you an examination, they can conclusively say, based on this examination, what your x-ray says, what your MRI says, and you can see that you have visual evidence that there's degeneration in this area. That doesn't necessarily mean that this recommendation of therapy, drugs, cortisone, or surgery is your answer. Now, in terms of therapy, if there's a structural component, yes, there's certain things that you have to do therapeutically, but many times there's other variables that are involved with these pain syndromes. So you have to be very careful when you're experiencing pain of any kind. Instead of asking this question of, what can I do to get out of pain? A better question is, what is causing my pain? And when you look at what's causing my pain, that's when you get to the root cause. And when you get to the root cause, that's when you can not only get out of pain, but fix your problem forever. So if you've ever been in pain yourself, you know someone is, make sure you share the video with them, or go through the video again. Make sure you understand that oftentimes there's multiple variables in why you're experiencing pain. So until I see you later, go out and make it a great day. You certainly deserve it. Bye for now.